Very pleased to present AB 2105, which requires a healthcare service plan contract or health insurance policy issued, amended, or renewed on or after January 1st, 2025 to provide coverage for the treatment of pediatric autoimmune neuropsychiatric disorder associated with streptococcal infections, or PANDAS, and pediatric acute onset neuropsychiatric syndrome, or PANS, prescribed or ordered by a physician or surgeon. I'd like to start by accepting the committee amendments and thank the chair and committee staff for their very thoughtful work on this bill. PANDAS and PANS are an inflammatory disease of the brain. They result in sudden onset, devastating behavioral and neurological dysfunction that usually occur after a triggering infection. These disorders are thought to be caused by autoantibodies generated after the infection that mistakenly attack the brain. Antibiotics or oral anti-inflammatory medication help most children, but a minority need stronger immune modulating treatments such as intravenous immunoglobulin or IVIG. Despite published PANDAS and PANS treatment guidelines that established a standard of care in 2017, insurers have continued to adhere to their own policy statements, forbidding authorization of immune-focused treatments such as IVIG. As a result, treatments are routinely denied. Early and expedient treatment of PANDAS and PANS is essential in order to prevent long-term and potentially life-threatening impacts of these conditions. Patients seeking immune-modulating treatments for acute PANDAS and PANS are frequently denied authorization for these treatments by insurers and must seek independent medical review at the Department of Managed Health Care. While the IMR process is effective, decisions are typically rendered within 30 days of qualification, meaning that the insured must first receive a denial from their insurer, file a request for independent medical review, and wait for a decision to uphold or overturn the insurer's denial. But unfortunately, it's too late. This timeline is simply too long for children suffering from PANDAS and PANS and is frequently leading to kids receiving treatment long after current treatment guidelines recommend. According to the Clinical Management of Pediatric Onset Neuropsychiatric Syndrome, early care for PANDAS and PANS patients is defined as receiving treatment within 2 weeks of diagnosis. Late care is defined as receiving treatment within 2 to 4 weeks of diagnosis. And very delayed care is defined as receiving treatment more than 4 weeks after diagnosis. Based on published clinical treatment guidelines for PANDAS and PANS, denials are frequently resulting in very delayed care for PANDAS and PANS patients, which results in worse health outcomes for patients and the need for long-term care, which results in greater cost to patients and their families, insurers, and the state. They say timing is everything, and in the case of PANDAS and PANS, it couldn't be more true. Early and expedient access to the treatments is crucial to the effective treatment of PANDAS and PANS in order to avoid the debilitating symptoms, potentially permanent neurological damage, sometimes fatal outcomes associated with these disorders. AB 2105 will ensure that individuals and families who are confronted with these disorders do not experience unnecessary delays in treatment that can lead to disastrous and tragic outcomes. It is my pleasure to introduce Dr. Angela Tang, the mother of a PANS child, and Dr. Susan Manful, co-founder and executive director of the Alex Manful Fund, who are here to testify in support of AB 2105.
My name is Susan Manful. I am a native of Fresno, California, although now I live in New Hampshire. I have very strong ties in my home state here, but I have come to see you today specifically to testify about this bill. I am the co-founder and executive director of the Alex Manful Fund, as Assembly Member Lowenthal just said. As this group supports research and education and awareness in PANDAS and PANS. But I'm here today as a mother because my daughter, Alex, cannot be here today. She's no longer alive to tell her story, so I'm going to tell it for you in 2 minutes, I promise. She was a paragon of health. 1 minute remaining. Okay, I'm not talking fast enough. All right, until she had strep at the same time that she had mono. She was our only child, and she lost her life at 26 years old in 2018 because she did not have a timely diagnosis and treatment. In fact, she diagnosed herself with PANDAS. And then she was able to get an appointment with the top neurologist who confirmed her suspicions and ordered treatment. My husband and I, my daughter, then worked to prepare for this notorious battle with insurance companies. However, she died before she was able to get treatment. We donated her brain to NIMH and to Georgetown, where we established a brain bank called PAND. That stands for PANDAS, PANS, and other neuroimmune disorders. It's the only brain bank in the country. So may I have 30 more seconds? Okay, thank you. Hers was the first brain in that bank, and in less than 3 years, we have 7 brains there. The youngest one is 14 years old. Most of them are teenagers. This is a remarkable growth for a disorder that's so little known and a brain bank that has not yet been promoted. Now, I'm talking about these brains as if they are commodities. They are not. In fact, I want to let you know that today, the family who donated one of the brains is celebrating the 17th birthday of that young person who died due to PANDAS. In Alex's brain, I can tell you the damage in her brain if you'd like, but she sustained brain damage. There was evidence of inflammation, exactly where the clinical symptoms suggested that damage should be and where the brain scans suggested that they should be. She had gliosis in her brain. That's evidence of brain damage that's seen in Alzheimer's patients, in MS patients, and other very serious neurological disorders. So please vote. Please support this bill. Thank you very much.
Thank you.
My name is Dr. Angela Tang. 5 years ago, PAN struck down my 15-year-old. My healthy soccer player could no longer walk. My straight-A student couldn't write. He spat out food if an intrusive thought struck, and he needed me at his side even during his tortured sleep. We dropped out of school, work, and life. With 2 doctor parents, my son got every oral medicine in the 2017 treatment guidelines by expert clinics like Stanford and Harvard. When he could no longer drink, he was scheduled for a feeding tube. The guidelines say that the next medicine is IVIG, but policies by Anthem, Aetna, and others say that IVIG is not medically necessary, experimental, and unproven. I luckily work for a large medical group issuing authorizations and denials for 15 years, and my doctor connections got him IVIG with improvement in a week, no feeding tube. Today he's off medicines and he's a pre-med in college nearby, and one day he may be your doctor. My son got IVIG 7 weeks from onset. According to the guidelines, past 4 weeks is very delayed care. But of the hundreds of cases I've seen, including at the Stanford PANS Clinic, where I am now an adjunct clinical associate professor, not one has received IVIG faster than my son. The norm is months to years of brain inflammation before insurance agrees to pay or is forced to pay by regulators, or parents sell off assets to pay, or kids get institutionalized, or they die. My opinions are my own as an insurance insider, parent, and PANS researcher, and today I make good on the oath I took to become a doctor when I ask you to protect the youth who lack doctor parents. Some say that existing regulations where insurers use policies by nameless employees who have never heard of this diagnosis to automatically deny IVIG and then have 30 days to respond to appeals are sufficient for this urgent diagnosis. Please consider if insurer definitions of medical necessity should violate peer-reviewed clinical practice guidelines by which AB 2105 defines medical necessity. Let's stop insurers passing the buck to taxpayers in special ed, unemployment, and disability. This bill costs $7,000 to enact and less than a penny in insurance premiums. Just to wrap up today, I give voice to the youth whose brains lie at Georgetown and to doctors who are shackled in their attempts to help. And today you choose for California's kids, no for Alex's path, or I for my son's path. Thank you very much.
I want to commend the families that came here today and the proponents of this bill that came to speak. It's a very emotional issue. And I also want to offer a hug to those in opposition. I can see how challenging it is and difficult it is for you to be on the opposite side of this. This is an issue clearly that affects the families, but in truth, it affects all of us. We're all paying for not dealing with this. These families have to utilize, many of whom have to utilize state social safety net services because the onset is so acute and so debilitating that they have to leave their jobs right away to care for their children, their ailing children, for a process that will ultimately get approved. So there's a cost, a huge cost, for us not dealing with this.